Okay. So. Sorry. Is that right question?
I'm gonna start your time.
Okay. So if you go to the argument that says that our current healthcare system is flawed and that so they say that it is a significant problem. We do have a problem in our structures, and that problem goes back to the fact that the financial system is racist and it doesn't take the time to look at the problems that we have. If you take this along with their third argument that says that we'd cause long wait times and have a disadvantage, as it currently stands, individual behavior is not the health problem and there are already long wait times. Dr. Sandra Galea, emergency physician, from Time magazine, June 22nd, 2017, says, unfortunately, our national conversation about health in general and healthcare in particular rarely acknowledges how injustice shapes the health of populations. In the U.S., we talk about medicines we take, doctor visits, exercise we manage to squeeze in, and our individual behavior. We are, in a sense, culturally conditioned to view poor health as a consequence of poor decision making. It takes little imagination to assume that someone is obese because she has made the choice to eat too much. It takes more effort to consider how her obesity represents the convergence of many contextual factors over which she has little or no control. Their third argument stated that we look to Britain as our model for our plan, and that if we look to them, we would have longer wait times and our medical care would be rationed. And he stated that they are turning away people with obese and who are smokers because of the fact that they already have these problems. But as it currently stands, minorities tend to use the emergency room as their wait time, so they're already creating wait times because they don't have insurance. So when they do end up sick or in care, they tend to go to the emergency rooms or they turn to like the most extreme care, which cause long wait times already, and they already have problems because of where they're at. Their second argument stated that changes aren't going to solve a cultural problem, that society needs to change. While this is true, it does show that the changes haven't been solved, so we need to try to make more changes. That's all I have.
Excellent. First first negative rebuttal.
If you remember, in my first speech, I claimed that their claim that changes aren't solving racism. I claimed that that was not an inerrancy problem, but rather a negative affirmative. Since they have not chosen to address this issue, I would like to point this back out and show that this is true. And she said that solving
Actually, 2 minutes left.
Okay. She said that it's not going to solve cultural problems, that this is true, but we still need to try to make new. We still need to.
keep looking at me for help. What's the help I've given every group for this moment when you're thinking, what am I supposed to say?
Solvency.
The stock issues, that's
Stock
right.
issues.
Talk about the stock issues. Which one do you want to talk about? Significance, solvency, disadvantage?
You said that the current healthcare system would, she said that the minorities already have long wait times, but I did not hear any quote for that, or so our disadvantage still stands. The
Second affirmative rebuttal.
Thank you. That's okay. I'd like to bring back Mr. Cicero to help us close this out. There is a significant problem, we have pointed this out on our occasion, that lack of health care has led to racism because the minorities are not covered. The inherency of the negative has admitted the system is flawed and that it is not being fixed. We are offering a solvency solution, a single payer system which has proven that it has been functional with Medicare, and that has been documented and verified. We have further proof on that solvency will get this for everyone's coverage, and therefore will also solve the racism, because it will become an infinitesimal minority of people who may not be covered, and it will not be a race issue. It could be some other issue of coverage. And I'd like to quote, bless you,
Thank you.
Olga Kazan, a staff writer from The Atlantic, and she said the ways to fix these issues are to increase the rate of insurance coverage and access to primary care, streamline the insurance system so that there are less administrative hurdles for doctors, and funnel more money toward better nutrition and housing rather than specialty care. So they would like to get everyone covered. And further off, if you would go back to The Economist, which is previously qualified, and the statement that comes through is that the European system is essentially similar to Obamacare. One salient difference is that because the Netherlands and Switzerland, by example, provide more subsidies, premiums are much lower. They also enforce the mandate much more strictly. As a result, they manage to insure over 99% of their citizens, whereas America insures only about 90%. All this may seem terribly complex. European countries' health insurance systems are, without exception, simpler than America's, which is a bewildering hodgepodge of private and public systems. We are providing with our solvency that will provide a single-payer system that everyone can be covered in this country, and through a reasonable methodology, which is now being introduced in Congress by Senator Bernie Sanders, that everyone, no matter what, can have access to adequate, fundamental right of health care. And all the authors that we have quoted, both The Economist, The New Yorker, The Atlantic, all state that moving in that direction, and it has been proven in other countries that this is the direction that we need to have as the United States. Because as a leading country in every area and the highest paying in health care, why shouldn't we have the best health care in the world?
Excellent. 2&R.
So in closing, the proposal is that we should implement a single-payer healthcare system. I am suggesting that we do not move to this type of system for reformation on our healthcare systems, strictly because it has been shown not to work, and because it costs taxpayers a lot of money. I mean, if we have our affirmative saying that the lack of health care is causing racism. I believe that to be an error and an overstatement of generalization, because it's affecting people with low income to be able to pay for health care in general, not just for anybody going to the ER. those that go into the ER still will receive health care regardless of any kind of discriminating factors. It is written into law that you will receive health care. Yes, paying for it is a whole nother subject, and this is why it would cost us way too much. If I have a quote here from Robert E. Moffett, Senior Fellow at the Heritage Foundation Center for Health Policy from Fortune.com. Huge, and it's stating that a huge budget problem with California's proposed single-payer health care bill, because the affirmative wanted me to cite a source for this. I will tell you, the quote says, state attempts to implement single-payer health systems have thus far been met with failure, but California seems poised to give it a try. The Healthy California Act, a single-payer bill that would displace existing private and employer-based coverage, has already passed the state senate. Coverage would extend to illegal immigrants, and if the state gets the necessary federal waivers, persons enrolled in Medicaid and Medicare, regardless of their preference in the matter. To control costs, the proposal would create a politically appointed board, Health California board, to set payment rates for doctors and other medical professionals. Working against these cost-cutting measures, however, are provisions to prohibit co-payments and deductibles, which they are routine in both Medicare and private insurances. Abolishing these consumer skin in the game features on the front end guarantees high overall program costs on the back end, and the costs are a huge problem. Analysis estimate the California plan will cost anywhere from $330 to $400 billion annually, and an amount larger than California's entire state budget. Its total state spending amount to about $183 billion for fiscal year 2017-2018. That's why it costs so much. It's already been estimated to cost that much or more. And that's why we should not implement this on a national level. It would cost everyone a lot of money in taxes. All right. Going with to the second affirmative rebuttal, the European healthcare system is simpler? Maybe so. But then again, they also have a different set of rules and different set of laws and a different whole system of politics compared to what we have here. We have certain systems in place already, and if what they're proposing is what I think it is, that means a complete government takeover of your health care. Meaning and that concludes my rebuttal.
Please give them a round of applause. Excellent. Naveen's coming over for the traditional handshake.